I'll spend a few minutes discussing the results of nivolumab, which is an anti-PD-1 antibody, which were targeting hepatocellular carcinoma. These results were presented at this meeting. There were two posters of interest. One that reported the follow-up results of the dose escalation phase of Checkmate 040, which evaluated nivolumab in hepatocellular carcinoma, and another related poster which looked at the expansion phase of this study that included 214 patients, and these are interim results. If we go back to the dose escalation phase, the highlights of this poster are that nivolumab was found to be safe across the disease etiologies for hepatocellular carcinoma in patients with hepatitis B, hepatitis C, or non-infected. It was administered in a dose escalation manner in 3 parallel cohorts, and there were no dose-limiting toxicities, and except at the 10 milligram per kilogram dose where there was one. But more importantly, the dose that's adopted in other tumor types, which is 3 milligrams per kilograms, was found to be safe in this disease. The response rate among mid-40-some patients was 15%, and the responses occurred across disease etiologies, hepatitis B, hepatitis C, and uninfected patients. The median survival in post-sorafenib patients, which were about 37 patients, was 15 months. Both of these results are quite intriguing and promising. Then if we move to the expansion poster, which looked at 214 patients, the safety profile there continued to be quite manageable there, and no different than the safety profile of nivolumab in other solid tumors. Specifically, if we focus on liver-related toxicities such as AST and ALT elevation and bilirubin, those were no different than other tumor types. The response rate preliminarily was 16%, which is consistent with the response rate seen in the dose escalation phase of the study. The survival data is not mature for the expansion phase, and we will look forward to seeing those results in future presentations.